Welcome to the deep dive. Today, we're taking a fascinating plunge into how reinforcement learning, or RL, is starting to revolutionize smart hospitals.
Yeah, it's a really interesting area.
We've pulled our insights from an article by Mira Oroujzadeh, and our mission really is to dig into how these algorithms like Q-Learning and SARSA aren't just buzzwords, but
Right.
actual practical tools changing things,
Yeah.
from bed management right through to complex treatment plans. Okay, let's unpack this.
Indeed. So reinforcement learning. Um, it's basically about an AI agent learning how to make the best decisions. It does this through trial and error.
Trial and error, like learning by doing.
Exactly. Think of it like maybe a computer playing a game. It tries an action, it gets a score, it could be a reward, could be a penalty, and it uses that feedback to get better over time.
Okay.
The main goal is for it to figure out the best policy.
The best strategy.
Yeah, the best decision-making strategy, the one that gets it the most rewards in the long run.
That's a great setup. So when we talk about these agents learning, let's start with Q-learning. What's its fundamental approach? How does it actually explore to find those optimal solutions?
Right, Q-learning. Well, what's really fascinating about Q-learning is that it's off policy.
Off policy. What does that mean exactly?
It means it learns the best possible actions it could take, regardless of what it's actually doing right now.
Okay.
Imagine maybe a chess player who learns not just from playing their own games, but also by watching grandmasters play, even if their own current strategy is, pretty basic.
I see. So it's looking beyond its own immediate experience.
Exactly. Q-learning is always looking for that optimal path, the absolute best way, even if it hasn't tried that path itself yet. Oh, and the Q, that stands for quality, the quality of taking a certain action in a certain situation.
So if I'm getting this right, it's kind of like it can see a complete, perfectly optimized GPS map before it even starts driving, not just the route it happens to be on at the moment.
That's a great way to put it, yes.
That ability, I mean, discovering totally new and maybe much better ways of doing things, that sounds incredibly powerful.
It is, precisely.
Yeah.
Its real strength is finding these potentially new, much more optimal solutions, paths that might look completely different from how things are done now.
Given that potential, where could Q-learning really, unlock value in a place as complex as a hospital? Can you give us some specific examples?
Oh, the applications are pretty transformative. For instance, optimizing vital resources.
Like what?
We're talking hospital beds, drug inventory levels, or even how often expensive equipment like MRI machines get used.
Right.
Imagine a system that's constantly looking at past patient data like patterns of visits, how long similar patients usually stay, maybe current patient vital signs. Based on all that analysis, it could predict, with pretty surprising accuracy, the best time to allocate a free bed or schedule someone for an MRI.
And the real impact there. It's not just about shuffling things around faster, is it? It sounds like it could almost redefine how hospital capacity is managed, moving from just reacting to being predictive.
Exactly. Almost like a hospital having a bit of a crystal ball for patient flow.
Yeah.
It could seriously cut down waiting lists in ERs, help optimize surgery schedules, maybe even help predict when patients might be discharged for much smarter bed management.
That makes sense.
But it goes beyond just those static resources. It also gets into fine-tuning medical devices.
Like what kind of devices?
Think of, say, a smart insulin pump. Using Q-learning, it could automatically instantly adjust the drug dosage based on a patient's real-time blood sugar levels and how their body is reacting.
Oh.
Or optimizing dialysis machine settings specifically for each patient's unique condition. In cases like these, Q-learning is searching for the absolute best possible settings for that individual.
That's incredibly compelling, especially for finding maybe revolutionary solutions. But in healthcare, that sensitive environment, sometimes you don't want to completely change paths, right? You need to be more cautious.
Absolutely.
Is that where the other one, SARSA, comes in? What's the fundamental difference between these two?
That's a really crucial distinction, yes. Unlike Q-learning, SARSA is what we call on policy, and it's also online.
On policy? Online.
Right. It means it learns directly from the experiences it's having right now as it operates, and crucially, it improves based on the exact policy it is currently using.
Oh, okay.
Its name, SARSA, actually spells it out. State action reward state action. It decides its next action based on its current policy. It learns as it goes, in real time, sticking to the plan it's already following, but trying to make that plan better.
Okay, so if Q-learning is like getting that perfect GPS map beforehand, SARSA is more like a careful driver who who only learns from the road they're actually on right now.
That's a really good analogy.
They might maybe try a slightly different lane or adjust their speed a bit, but they stick to the main highway. They're constantly improving their technique for that specific route, not trying to find some totally new shortcut through back roads.
That nails it. Its whole strategy is about gradual, safe improvement of the processes already in place. And that caution is exactly where SARSA really shines in a hospital setting.
So where does that kind of cautious step-by-step improvement become really essential in patient care?
Well, it's highly suitable for situations where stability and patient safety are, the absolute top priorities.
Like,
Consider adjusting dynamic treatment plans. Physical therapy, for example.
right.
The system can adapt the program based on how the patient is progressing in real time, how they responded to the last session.
Okay.
But it does it cautiously. It stays within the framework of the existing treatment protocol. And it's not going to suddenly try some completely new, untested therapy.
Right, no sudden changes.
Exactly. It ensures there are no sudden, unexpected shifts. Similarly, maybe adjusting drug dosages for chronic patients, like diabetics. The changes would be more gradual, carrying significantly less risk.
So it's kind of building trust in the AI where it really matters most, making sure that even in critical situations, the system learns and adapts, but without compromising safety.
Precisely. Wherever a sudden change could be dangerous, like fine-tuning vital life support equipment or maybe treating very vulnerable patients, SARSA is often the more suitable choice because its focus is squarely on safely refining the current process.
Okay, so if we were to quickly summarize the core difference,
Yeah.
for someone who really wants to get the distinction clear in their head,
In short, Q-Learning explores. It looks for the very best possible path, even if it's revolutionary, a totally new one. That makes it great for potentially big, transformative changes.
but needs precision.
Exactly. Needs very careful implementation. SARSA, on the other hand, prioritizes safely and gradually improving the path you're already on. That makes it a safer bet and excellent for continuously refining established processes.
So the choice really depends.
It absolutely hinges on the specific goal and, the tolerance for exploration versus the need for stability.
And what this all means then is that these reinforcement learning algorithms, they have these distinct approaches, but both are really powerful tools. Tools for making hospital decisions smarter, more efficient, maybe even more personalized.
Definitely.
From managing the basics like beds and medications, right up to precisely adjusting complex treatment plans. Okay, here's where it gets really interesting.
And that power, that potential, it does bring up an important question, something for you, our listener, to think about.
Right.
These systems, they primarily learn from past data, from experiences, right?
Historical data.
So this raises a pretty important question. How can we make sure that when these systems face something completely new, a medical situation they've never seen before, like maybe an emerging disease or some unexpected scientific discovery where there is no historical data, how do we ensure they can still react correctly and safely and
Right.
quickly and adapt themselves?
That challenge. Adapting to the truly unknown in a clinical setting. Wow. That certainly feels like one of those critical frontiers for advancing these technologies in healthcare's future.
It really is. It's a key area for future research and development.
That definitely gives us something profound to mull over. Thank you for diving deep with us into this source material today.